precious gift. It behoves on us to always take care of them at all times with gratitude. Thanks for staying tuned in the new year 2024 as we bring you Eyes on the Road, your Thursday Eye Health Tonic on Lagos Traffic Radio 96.1 FM. My name is Akan Hussein. Happy New Year to all our listeners. As we begin the new year, it is good to include eye care in your budget and of course plan for good health. Yes, even as we set those goals, motivational speakers here and there have been giving you tips on how to set goals and do all that. Do not forget eye care in the mix. Okay, now some pertinent questions we'll definitely be asking and answering in this new year as regards our eyes, which I feel you should also factor. What are your eye care goals, even as you talk about your other goals that you want to achieve? When do you want to have a comprehensive eye examination in this year? This along with some other areas of attention for our eyes will be on the front burner as we look and treat the topic New Year Eye Care on the show today. But first, let's see if we can chip in one or two traffic updates just to let you know what things are looking like traffic-wise, of course. Okay, so at this time around the Iju-Shaga axis, I understand that towing coming towards Iju-Shaga roundabout is a bit of a slow movement. Coming down to Fagba Junction is also slow. Agric Road, Pipeline, slow. Going down to College Road, it's free. Going down to Ogba for those heading towards that end is a bit slow. Okay, so this one is not from a traffic manager, actually. It's coming from a commuter. Sextus, thank you very much for this. And let's see if we can get one from the control room. Okay, control room, the update we have here is touching the Dopemo axis. Shasha traffic light and its environment still good to go from there on route Jimo bus stop to Gulano Junction, still flowing appreciably. The return journey from Gulano Junction to Akomonjo roundabout and its environment leading to the Lagos Abeokuta Expressway is okay inwards and outwards. From Cement to Dopamo under bridge to Goyi Junction is quite encouraging. Swiftwire is okay, no traffic challenges at Akiwawa also for now. All right, so ladies and gentlemen, boys and girls, mommies and daddies, join me as I usher in Dr. Priscilia Imade, Doctor of Optometry with a PhD in Public Health, and she's also a consultant optometrist at the Modern Eye Foundation situated at Omole. Welcome to the new year on the show, and Doctor, hope you're not shy since it's your first time in the new year.
Oh, happy New Year! We made it to year 2024.
Indeed.
Wow, what an applause. Glory be to God. I'm happy, I'm excited, and I'm not shy.
I thought you didn't hear that part. Like your first time. Okay.
Oh my God.
So we're building our searchlights. Eye care, New Year eye care. Why this topic? Why?
Honestly, that's a good way, a good question to ask. Well, most time our discussions on Eyes on the Road stems around my interactions with listeners, with my patients, and all. So I just come on air to come and answer the questions aloud. Well, 2023, many people felt it was a hard year and that the economy wasn't really smiling.
Indeed.
And then now we're in 2024. And we got talking. There's, this tendency for you to just say, oh, the economy is not okay, it's not good. And, for you to just overlook your eye care or overlook your eyes and leave it out of your budget. So our discourse this afternoon is to say, okay, yeah, we're in 2024. The economy may not, be as perfect or as good as how we want it to be. But in the midst of that, we still see with our eyes. And if we are not taking care of these eyes that we're seeing with, something devastating can happen. This new year alone, at least I have seen a little, at least below 10 blind people.
Wow.
So people are still getting blind.
Wow.
Yes. Either in two eyes or in one eye. Today is just fourth.
Oh
Yes.
dear.
So these things, in fact, we just have to we just have to make sure that we are doing all that we can to ensure that our eyes are preserved. So, starting the year and then drawing out a budget to say, okay, this year, this is what I want to do about my eye. These are my plan for my vision. These are my plans. You know, generally,
even as you're setting goals for the other
the
parts
year
of your life.
2024, exactly. Don't leave out your eye health. That's just the main bane of the eye care that we are going to discuss. We are starting this new year with. You don't want to go blind. In fact, before I came here, one of my consultants called me. There was a case we were co-managing.
Meanwhile, doctor, that's a really lovely frame.
Wow. Please, my listeners see me on Facebook, on social media.
Facebook.
Please,
Lagos Traffic
just give me
Radio,
a thumbs up.
96.1 FM. That's the page.
I got to show it, you know. I got to advertise it. Thank you.
True. That's what you're saying.
Yes.
Okay.
So before I came, like I said, it was so pathetic. A young lady, and then it's a neurological problem.
Wow.
One eye is already gone. We don't know what will happen to the other eye. There was also another lady again, the same thing. And I'm like, God, what's happening today alone? Like 3 cases or 4,
Wow.
just today alone. I'm like, what is happening? So all these things we need to. Sometimes it's a reflection of what we did previously. We always say that the eye does not just suddenly go bad.
When you say
It
what
has
we
been-
did previously,
It has been our attitude, our conception, our beliefs, the way we have handled our eyesight. That is why this new year, you must make a conscious effort to begin the year with a plan for your eye care, for your eye health, for your eyesight. You must be intentional about preserving your vision, because whether the economy is smiling or not, you will still need your eyes to see. Without the eye, you will not even see whatever it is you have labored for. So what are your goals? What are your eye care goals for this year? Those are some of the questions I'm going to pose to all my listeners and people who are viewing from all over the world. What are your eye care goals? How do you want to move your eye health forward, so to speak, this year? Did you have an eye check last year? This year, are you putting it in the plan to have your eyes checked? If you are a glasses wearer, are your glasses weak? Do you plan to change your glasses this year? Do you plan maybe to buy a new frame and have a new look like I am for this new year? So these are things you must put in the plan. Resources may be limited. So if you don't plan properly, you may end up not having the money to do the needful.
talking about planning, like those who perhaps are becoming 40. There's something you said last year about getting to a certain age. There's some certain things that will happen to your sight. You should also factor that.
Thank you, Akan. You are about the age of 40. If that matters, you must factor in, that eye test will become part of your life from henceforth. So in setting your goals for the year, you must include your eye care goals. And then there are also some people who just come in and say, no, I just want a routine check. I don't want comprehensive check. This year you must say, I want comprehensive check. And then there are some screening tests too that one can do on the eye, like glaucoma screening, dry eye screening. Just deliberately do these screenings, not necessarily because you have the problem or the disease, but as a goal, as a plan. And then, like we said, don't forget to put a budget on your eye test or eye care. Then when you have done that, there are certain areas that you must deliberately pay attention to this year about your eye health. You must be intentional. I think that's the word. Be intentional about your eye health, about eye care this year.
Okay, like just on a funny note, there's this slang that has been going around that in 2024, not grief for anybody. So also I would say no grief as regards your eye health. Make sure you are intentional. Make sure you not grief.
If you have seen anybody gone blind,
you know go grief.
You know go grief. This is our profession. Sometimes you see people. I have seen the rich go blind.
Wow.
I have seen the poor go blind. I have seen young go blind.
So
I have seen old go blind.
It's not
I
a
have seen
factor of
male,
money.
female, different ethnic groups go blind. Blindness is not what anyone, in fact, you can't even wish it for your enemy. Somebody that is one-sighted, once you lose your sight, is so painful. And many a time, from statistics, some of these people, they are not able to handle it. They enter depression, and before you know it, they die. So please, you can do something. My pain is that it's a situation you can prevent or save. But because you are negligent, it just occurs and it happens. So please, this 2024, let's be deliberate. We are starting the year now on a thought-provoking note. We need to really do the needful as far as eye care is concerned. Areas of attention for this year, 2024. Number one, you must pay attention to what you eat, what you put into your body, what kind of food enters your system. The thing you put into your mouth or into your body, are they things that will help your eye health? I know, a lot of people because of the festivities, we ate a lot, drank a lot, and things like that. But now we are in 2024. You have to be sober. That food, before you eat it, ask yourself, is it going to help my eye health? If it's not going to help your eye health, then you have to drop it. Toxins, you want to put something in the eye. Are you putting toxins? Are you damaging your eyes? These are salient questions we must look into this year, because we must be intentional about preserving our eye health. And then you must know your eye health history. I have been saying it. Know the type of eyes that you have. All eyes are not the same. My eyes and your eyes are not the same. Even the two eyes are not exactly the same. What kind of structure, what kind of morphology, or how does your eye work? You need to understand, are you short-sighted? Are you long-sighted? Are you presbyopic? Do you have astigmatism? Do you have all these different words we say here about the eyes? How is it? So that you will know how to take care of your eyes. When you understand, then you'll be careful. When you understand some things about your eyes, you know some of the things you should deliberately avoid. For example, people who are high myopes, anywhere they see fight, they should just run away, because if by mistake somebody slaps you, the left hand can detach.
What is high myopes?
Or we have discussed all those things on this program. Go back and go and review some of the old episodes. Go and look at myopia.
Okay, but for first-time listeners, for the benefit of first-time listeners.
Okay, that's fine.
High myopes.
People who are myopic, who are short-sighted, especially when that short-sightedness is high, most times their retinas become very thin, and any trauma, any injury can cause a detachment.
Okay.
So somebody that maybe you are already using glasses of like maybe -4, -5, -6 or above, and then somebody is fighting, or you see people fighting, don't even bother to pass that road. So just change your route.
Don't do Lagos
because at all. Because or you go and be looking for trouble. Don't separate. Don't even look for trouble, because if by chance or by mistake somebody punches you. I once had a patient who, she was a high myope, and then she had a scuffle with the husband, and the man just gave her one more. And by the time they came, her retina was detached. I'm telling you. So we don't want that. So why I'm saying this is that when you understand the kind of eye that you have, your eye structure, your eye morphology, you'll be able to avoid some things. And then you'll be able to preserve your eye health. Then know your family history as well, as far as eyes are concerned.
All right, Doctor, we seem to have a caller. Let's see if we can take this. Hello.
Good afternoon. Happy New Year.
Happy New Year, Grandma. Happy New Year, Ma.
Thank you, Raju. I'm a DIS Dr. Imade.
Thank you, Grandma. Happy New Year.
Happy New Year. Happy to hear you. 2024 is a glorious year. More glorious.
Amen.
You continue shining and shining and shining.
Amen.
In Jesus' name.
Amen.
Thank you so
Hi,
much.
Dr. Rash.
Yeah, she's fine.
Yes.
They are fine. They are fine. How's your head, Grandma? I hope you are doing great.
Yes, ma.
Okay.
Yes, ma.
The Lord
I
is
was even
your strength.
I'm even planning that maybe I will come and do that my test next week, but
Exactly. Just
I
come
will
for
let you
review.
know, sir.
Okay.
All right.
Thank you, Grandma.
Thank you, Grandma.
Okay.
Yes, ma.
Thank you for that question.
Thank you.
That short sighted
My-
sightedness. The way doctor called it, I said, which one is it?
Hi, oh, thank you. So it was not only me. Hi, Mayo. What's me? Hi, Mayo.
Yes, not only you. And I salute our elder.
Oh,
Have
dear.
you called?
He hasn't yet. He hasn't
Yeah,
yet.
called.
He will come and register soon.
Yes.
Good to hear you, Grandma.
Thank you, Grandma.
Yes, thank you so much.
Thank you so
080-991-20777. We actually hadn't dropped the numbers, but a few of our callers, regular callers, ardent listeners who have the numbers already calling in, you can be part of this. 080-991-20777. You can also call via 091-538-77127. You can just call in, ask your questions, or perhaps you just want to greet the doctor. It's fine. Or you want to ask questions, you want to know when you can come in for the comprehensive test. It's fine. We'll definitely let you know. The phone lines are open. Facebook, you can also come in, see us via Facebook, send in your questions and concerns via Facebook. That'll be amazing. Hello.
Happy New Year.
Elder.
Wow.
Happy New Year. Happy New Year. Happy New Year.
Our dear doctor.
Happy New Year, sir.
Doctor,
Well done,
yeah, command awa.
Yes, sir. Yes.
I'm fighting you.
Don't fight me, Elder. We're coming for you. We're coming, sir.
Okay, no problem.
Yes, sir.
Well done.
Thank
Yes,
you
sir.
very much.
All right.
I send my greeting to
Dr. Rashida.
Dr. Akidat.
Yeah. Shall we hear,
And
sir?
I also greet our grandma.
Okay.
Yes, sir.
Thank you very much.
I heard her voice now.
Yes.
I knew you were listening. Well done, sir.
Thank
Well
you
done,
very
sir.
For us there.
Thank
Definitely,
you.
sir.
Thank you.
Thank you. So great to have you call us. Yes. Okay, 080-991-20777 and 091-538-77127. We're talking New Year eye care.
Yes.
Doctor, we have another caller. Hello, good afternoon.
Good afternoon. Thank you very much. Thank you for calling out my name. Happy New Year.
Please, could you reduce the volume of your radio set?
Okay, now, I wanted to find out something. You were talking about the kind of things that we need to be eating because of preserving our eyes. So I don't know what are those things that we could be eating now.
Okay.
So that we don't get our eyes into trouble now.
Okay. What's your name, please?
What's your name and where are you calling from?
Barbara is my name and I'm calling from Marina.
Okay.
I think you're Barbara.
Yes,
Oh,
sir.
great. Thank you for calling.
Okay.
Okay, doctor.
you.
Yeah.
Thank
Listen
you.
over the
Thank
mic,
you,
yeah.
Barbara. That's a very good one.
Oh, I
Yes.
think you should add into that question. What should we avoid?
Okay. Okay, what you should avoid? Avoid anything that would be detrimental to your eye health. Number one, smoking. Alcohol.
In terms of
Bad
diet,
food.
like she's talking.
Now, the food you should
Yes,
eat,
yes.
food that are rich in antioxidants. Why is my producer laughing now?
No worry, we understand. Doctor, please go ahead. Another caller. Hello. Hello.
Good evening.
Yes, Happy New Year
Happy
to
New
you.
Year.
Your name and location, please.
Good
Yes.
evening, doctor.
Good evening, sir.
Happy New Year, ma.
So who's on the line?
Yeah, today is on the line.
Today, okay. Welcome.
Yeah.
We're calling from where?
Doctor, please, I'm calling from right now. I'm presently in my shop.
Okay.
Presently in my shop.
Okay, please go on.
Okay. Yeah, please, doctor, I want to ask first, do you open on Saturday?
Yes, sir, we do from 9:30 to 3:30. 9:30 a.m. to 3:30 p.m. Yes.
3:30.
Yes.
Okay. Yeah, please, I don't know. HMO.
Yes,
I
yes,
don't know if I
yes,
can
yes,
call the
yes,
name of
yes.
it.
We use HMO. Yes, you can send me a message. I would.
We'll drop her number at the end of the
after
show.
the end.
Just keep listening, okay?
Yes, please call. We have HMOs. Yes.
Okay.
Okay.
Thank you very much.
Please, when I'll send you a message, please.
Uh-huh.
All right.
You can give us the number of
Okay.
Okay.
I'll read it.
Okay.
Thank you very
Thank
much.
you, ma'am.
Happy New Year. Thank you.
All right. I think that should be our last caller. Yes, for time's sake.
Okay. Yes,
Doctor.
foods that you should eat. Please underline food rich in antioxidants. Those are the foods that are good for the eyes. Antioxidants are, foods that help to fight oxidation in the body. They combat free radicals that spoil your body or spoil the eye. I'm just saying it in a layman's language. And these antioxidants can be found in fruits and vegetables. So what are the fruits you should take? Carrots. Instead of drinking carbonated drink carrot juice. I gave you my carrots in my Christmas juice last week. Eat greens. All these are our local foods. Avoid processed foods. Avoid processed food. Anything processed will lead to acidosis. It will not make your body to function very well. So try and avoid those things. Fruits and vegetables, they are the best for the eyes. That means salad. Things like salad, uncooked food actually is the best for the eyes. If one of my patients say, doctor, you are saying I should be eating like goat, I'll be like a cow that will be eating grass. Say I cannot eat grass. Salad is grass. Please, salad is not grass. You can do fruit salad, you can do vegetable salads, it helps. And then you can also eat your greens and then eat your food early. Potato is also very good. Sweet potato, Irish potato, try as much as possible. The unripe plantains, these are good. They help your body, they also help the eyes. And avoid eating late at night. Sometimes actually it's not about even what we eat, it's about when we eat. Many of us in this part of the world, we eat so late in the night that at the end of the day, that food becomes poisonous to our body and even to our eyes. So when you eat matters a great deal. And then avoid overcooking or over-processing your food. You first of all buy the ugu in the market. Some would have dealt with it. You bring it home again, wash. You wash away all the vitamins. Then you now boil, throw away the water. After boiling, you fry. After frying, you put in the fridge. After putting in the fridge, you defrost again after 2 weeks. You take from it again. You put it back. You put it. At the end of the day, you are eating for pleasure and satisfaction. There's no nutritional value in what you are eating again. As much as possible, please, let's try to eat our food as fresh as possible. Avoid processing and over-processing your foods. So if you do all this, it's going to help your eye health. We have so many fruits. God has blessed us in Nigeria. We have so many fruits in season. There's no month that at least you will not find a fruit. There is no season you will not have something to eat or to take as far as fruits and vegetables are concerned. So please, let's make good use of them. They are going to help our eye health. So as we begin this new year, the things you should pay attention to what you eat. That's the number one. I have said, nutrition is key to having good eyesight. What you drink water. There is no substitute for water. Make sure you drink enough water every day. Water lubricates your body, lubricates your eyes. The eyes is made up of about 60 to 80% of water. The same thing with your body. We have intracellular water. We have intercellular water all over our body. So we need them. Then sleep well. Sleep is good for your eyes. There are some small eye problems you just be having. If you sleep very well, 6 to 8 hours, by the time you wake up, you'll be fine. There's no need for you to look for Dr. Imade. Please make sure you are sleeping well this year. It should be part of your eye care resolution. I will sleep and sleep well. Yes, we know that there is problem, there is stress. Once you lie down, close your eyes, forget all the stress, put it in the hands of Jesus and just sleep. Sleep off. Enjoy yourself. Enjoy your sleep. And when you wake up, you will be fine. And also, as much as possible, don't harbor grudges. Don't harbor things that will disturb your general homeostasis or your in medicine, both the psychology, the anatomy, everything work together. So as much as possible, just have a positive mindset, have a positive attitude towards your life, towards your health, and towards everything. Just, in fact, don't join the people that is condemning that Nigeria will be bad, Nigeria is that. Just saying everything will be fine, all will be well. Just, if you have nothing else to say, just say God bless Nigeria. Just leave it there and trust God. So sleep well, avoid harmful practices. Don't put anything like toxin in your eye. And if you peradventure have any symptom, you feel anything, please come early to the clinic, because symptoms are a warning sign that something may be going wrong in your eye. And if you don't come early, you may lose your sight by the time you present to the clinic.
Oh, great. What a great and amazing way to start the year. Yes, of course, you know that no one should go blind is our reason for always painstakingly, going through, bringing you this show year in, year out. And 2024 is not going to be a difference. Yes, indeed. We'll definitely make sure we bring you quality topics, and Dr. Priscilia Imade would give her a game as regards giving you quality eye health tips. Okay, so do know we appreciate your feedback, because it actually helps us serve you better pertaining to topics we also have discussed on air. Please do not stop giving your feedbacks. Keep them coming. You can go back to our Facebook page, have a rewatch. Just go look for the Facebook page if you're not already there, if you're not already followed us. Lagos Traffic Radio 96.1 FM. You can also check out our YouTube. Yes, our YouTube channel. It is Traffic Radio 961. Search for the keywords Eyes on the Road, and don't forget share. Okay. Dr. Priscilia Imade, OD, MSc, PhD in Public Health, is the consultant optometrist at Modern Eye Foundation, situated at plot 16 to 18, Ogunusi Road, opposite Omole Estate, Phase 1. That's by Akiode Bus Stop in Ojodubaja. And you can reach her on 080 3333 6672. That is 080 3333, that's 3 in 4 places, then 6672. On behalf of the production team led by Micah Arocha and our executive producer Tayo Akoli, I am Akan Usen, wishing you a remarkable journey in the year 2024. Catch you next week.
You never know to teach you how to be.